understanding and fighting your anxiety. Have you ever experienced shortness of breath, racing thoughts, or feelings of absolute panic that seem to come out of nowhere? That is what anxiety can look like, and it's important to learn how to handle anxiety when it surprises you and threatens to ruin a perfectly good moment or day. Anxiety disorders are the most diagnosed mental disorders. They fall into several categories: panic disorder, social anxiety disorder, generalized anxiety disorder, and specific phobias. Panic disorder is commonly associated with the feeling of anxiety that hits you out of nowhere. These are often referred to as panic attacks. What are the warning signs of a panic attack? Panic disorder is characterized by sudden and unexpected panic attacks. Panic attack may feel like they hit you out of nowhere. However, there are common warning signs, and learning to identify them is the first step in learning how to handle anxiety. Here are the common symptoms associated with a panic attack: difficulty in breathing, tightness in chest, heart palpitations or rapid heartbeat, sweating, shaking or trembling limbs, feeling dizzy, nauseous or faint, perceived loss of control or becoming detached from the body, fear of death. What causes anxiety? Anxiety can have many root causes, and knowing them can help learn how to handle anxiety in a more comprehensive way. The fight or flight response. While an anxiety attack may feel debilitating, it is the body's natural response to danger. The fight or flight response is activated rapidly by the amygdala, which is the brain's threat detection center. This response happens suddenly and without warning to help you respond quickly to danger. However, the system may become overactive when you have a history of trauma, an abundance of stress, or excessive fears about the future. Your brain may become hypersensitive to potential threats and detect danger everywhere. Conditioned fear. Psychological studies have determined that fear and anxiety may be conditioned. For example, pairing a neutral stimulus with a negative experience may lead to the neutral stimulus becoming associated with fear. For example, if you experience a panic attack while driving, you may start to associate driving with panic. As a result, driving may become a negative experience and general source of panic attacks. Medical conditions, genetics, stress or trauma. Anxiety may be the result of health conditions that mimic panic, such as heart arrhythmia or hyperthyroidism. This speaks to the importance of meeting with a medical doctor at the onset of anxiety to rule out medical causes. Genetics may also play a role in the development of anxiety. If you have first-degree relative diagnosed with anxiety, you are 40% more likely to develop anxiety. Anxiety may also be resulted from chemical imbalances in hormones such as serotonin, cortisol, or gamma-aminobutyric acid. Additionally, stress may play a major role in the development of anxiety disorders. You may be at an increased risk of developing an anxiety disorder if you have been exposed to catastrophic or ongoing stress.
How to handle anxiety with self-help techniques. Practice diaphragmatic breathing. One of the most common symptoms of anxiety is difficulty in breathing. Shallow breathing can limit airflow and increase feelings of stress and anxiety. Diaphragmatic breathing, also known as deep belly breathing, taps into the full capacity of the lungs while restoring a state of calm. To practice diaphragmatic breathing, begin by placing one hand on the belly and other on the chest. Attempt to send the breath into the lowest part of the lungs. You should feel your belly expanding on the inhale and contracting on the exhale. If you notice your chest rises more than your stomach, attempt this lying down. If you still have difficulties, try breathing into a paper bag. Alternatively, you can slowly inhale through the nose and fully exhale through the mouth. Diaphragmatic breathing takes practice. It's okay if it doesn't work on the first attempt. It is also important to practice when you feel calm. Develop a mindfulness practice. Mindfulness simply means present moment awareness. Mindfulness practices have been shown to decrease symptoms of depression and anxiety. They have also been linked with increased quality of life. Utilizing the 5 senses can be helpful if you are new to a mindfulness practice. One technique that focuses on the 5 senses is called grounding. It is a simple and quick method for returning to present moment and regaining a sense of calm. Try this grounding activity. Notice 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Repeat this activity as often as you like when learning how to handle anxiety. Avoid stimulants and smoking. As you have learned, people with panic disorder are hypersensitive to bodily sensations that mimic panic. Stimulants may trigger the fight or flight response. Sources of stimulants include coffee, cold medicines, and some over-the-counter medications. Additionally, people with panic disorder are hypersensitive to breathing abnormalities. Smoking can restrict oxygen in the brain, which increases heart rate and may result in panic. Try to focus yourself with mindfulness practice whenever you feel panicked.